Hey guys, it's the Doc, and here is the next installment of the hashtag Ask Dr. Mudgil series of posts. And this one comes in. TikTok is where it's at these days. These questions are all coming in from TikTok. And this one comes in from username Kevin J. Meng. And he asks, Doc, if the person have lipoma, is there any way to make it gone or shrink without surgery? Is that possible under 20 years can get lipoma? So I think that's a great question. What Kevin is asking is there a way to non-surgically remove a lipoma? And well, there's two parts of the question. So that's the first part of the question. And the answer is kind of, I guess. The mainstream way and the most surefire way to get rid of a solitary lipoma, or really any lipoma, is surgically. You make an incision, you get the lipoma out, you reapproximate the skin, and then that's like a 99% cure rate for a lipoma. There are some outside of the box ways to get rid of lipomas, but they're not surefire. And they may require multiple treatments. It's kind of hit or miss. There's ways to inject something into a lipoma to dissolve the fat, kill off the fat cells. Again, that generally requires multiple treatments and is not a guaranteed way to remove a lipoma. There's other modalities, like technologies that you can use to kind of like blast a lipoma with ultrasound, or there's other ways that you can try to destroy a lipoma using like lasers and other devices, etc. But again, those are generally very, very expensive. They're not guaranteed to work, and they generally require multiple treatments. So the long answer is, I just gave you the long answer. The short answer is it's possible, but the gold standard is really surgical removal, especially if you only have one lipoma. The second part of your question, is it possible for someone that's 20 years old or younger to get a lipoma? And the answer is yes. Lipoma is just a benign growth of fat cells. And it can really happen in any age. So it can happen in someone who's less than 20, it can happen in a teenager, it can happen in an adult, it can happen late in life, it can happen early in life. Anyone can get these sorts of things, just sort of a random thing that can happen. So I hope that answers your question, Kevin. Let's get it.